Assalamu alaikum. Hello everyone. Today our lecture will be about the rapid test for the parasite. Most of you know what is the rapid test and how we are done this test. But today we are talking about what is the rapid test for the parasitology. We are use it or not and how we can help us to diagnosis and detection of the disease that caused by parasite. The general principle of the rapid diagnostic test for the parasite. Generally, this test is done, and principle of this test, which is that binding antibody with antigen and visualization on the strip. We have the strip, and we see this line that appearing in the strip by binding antigen with antibody. What is the sample type we are using? Mostly we are using the blood, stool, urine, and other body fluid. Any body fluid we can use it for the rapid test by adding the small drop of the sample, and then this drop we are put it into that small portion into the strip, and if there is have antibody or antigen, it will be binding to each other, and we can visualization this line on the strip. For example, we have the lateral flow assay used as a gold latex bed for the visualization detected. That's meaning the name of the test, which is the name of the rapid test we are using mostly in our laboratory. What does meaning? The advantage of this test. Advantage of this test, we have the point of care. Point of care, it's meaning the patient can do this test in the home without going to the any point of the medical or going to the laboratory or going to the hospital. They can do by itself and at that home. That's meaning a point of care test. Also, the ease of the use and the cost effectiveness. The speed is also the result is a minute. It's meaning don't take a time to give you the result. It's meaning about 5 minutes maximum to the 10 minutes and give you the currently result that you are needed. And there is not very expensive and easy to use. It is not needed to be you have to experience or you have the knowledge to do this test. It's easy to use, and also you can do this test at the home without giving any laboratory. Here we have the example, malaria. It is reducing a turnout the time from our 15 to 20 minutes in the field setting according to the WHO data. Here, as you know, we have advantage and disadvantage. Here we have that limitation of this test. Limitation, it's meaning that disadvantage. We have the sensitivity and specificity is a variation. What does meaning the sensitivity? Sensitivity, it's meaning it give you the true result. It give you the true positive result. Well, the specificity, it give you the true negative result. That's meaning a difference between the sensitivity and the specificity, and that's dependent on rapid test, population, and the disease stage. What is the stage of the disease that patient have or get it now? So that's affected the sensitivity and the specificity of the result. That's meaning the one of that limitation. Another limitation, we have that cross reactivity with other infection. Maybe patient have another kind of infection, for example, maybe have that viruses, have the bacteria or another kind of the parasite. That's meaning antibody will be by mistake attachment this antigen and give you the false positive result. That's another limitation for this test. You have the qualitative result. Qualitative, that cannot be detected for you the severity of the disease or the level of the disease, unlike the PCR or ELISA that can tell you what is the level of the antibody or also that can give you the load of the parasite. Well, this test unable to give you the qualitative result. Another kind of that limitation, we have needed to do the confirmatory test. What does meaning confirmatory? It means when you do this test and give you the positive result, you have to be confirmed. That's only a point of care, but not give you the identified result. Because if you have the positive result, you have to be confirmed by ELISA or also by the PCR. For example, IgM antibody can persist for the month after acute infection, lead to give you the false positive result, especially in the pregnant woman. So that's mostly commonly occur in our community. So when you done the rapid test and there is a positive, to make sure before you take a treatment, you have to confirm it by another laboratory test. Here we are talking about what is different between sensitivity and specificity. Sensitivity, its meaning when give you the true positive. The positive, it is meaning you have the disease. Identify correctly the people who have the disease. When we say that this is a very specificity, it give you the true of the negative result. Negative result, it meaning you don't have infection or you don't have the disease. That's meaning a difference between the sensitivity and specificity. Sensitivity tell you have the disease or not. You have the disease. Well, the specificity tell you don't have the disease. Well, the high sensitivity, high specificity is a very few false positive, and high sensitivity is a very few false negative result give us. So now we have the rapid test for Toxoplasma gondii. This test we are mostly do in the parasite for detection if the patient have Toxoplasma or not. Toxoplasma, as you know, and there's a common people knowing there is a cat disease. This disease maybe we have that acute in the first stage, and also maybe there is a chronic. So what is the rapid test that help us to detect Toxoplasma? The name is a lateral flow assay. Lateral flow assay, which is a targeting for IgG and also for IgE. If there is a disease in the early stage, the IgM, it will be give us 85% of sensitivity and 95% of the specificity. While if there is a IgG, which is a chronic toxoplasmosis, chronic antibody, tell us 85% of sensitivity and 95% of the specificity. So the lateral flow assay is a very sensitive, and the specificity for the Toxoplasma gondii, either there is a acute or there is a chronic. If there is IgM persist, it's meaning acute infection. If there is IgG persist, it's meaning a chronic infection. And also you can make a confirm it by to that ELISA, and also the sensitivity this test, specificity this test, it is similar to the ELISA. So what is a clinical application for Toxoplasma gondii and rapid test? Why we are do the Toxoplasma rapid test? For screening the pregnant woman, if there is a woman at a pregnancy and in the first semester, in the initially story of the disease, we can do this test to know before the disease be chronic. In the acute infection, if you are diagnosed with this disease and you start to treatment, the disease will not be development. So that screening for pregnant woman, we are do this test. Another use we are used for immunocompromised patient to start it for managing and before the complication occurred, because immunocompromised complication is detected in the early stage because their immune is low. Where the monitoring for the treatment response, it's meaning when you give the patient the treatment, you are diagnosed with toxoplasma, but you don't know the treatment it is responsive or not. If the treatment responsive, we are start to monitoring, we are look after the patient. The patient is undergo the healing or non-undergo the healing. This treatment is responsive or non-responsive. Thus, meaning we are using Toxoplasma gondii rapid test. Another course, we have the point of care test in resource and limit setting. We are do this test because there's a point of care. It is not needed to go to that laboratory to do this test. You can do it at to that home with a least effect on yourself. Least cost, that's meaning help you and clinically applicated you are using the Toxoplasma and the rapid test. And example we have used it for the prenatal clinical to screen pregnant woman during to the first trimester. Thus all things help us and allowed us to do the clinical application of Toxoplasma gondii rapid test. Rapid test, we have the place you are added the buffer. What is the helpful of the buffer in our test? The buffer helps the sample flow smoothly, and meaning the helping to flow of the sample, and also maintaining the pH chemical stability, to non-changing the pH and stability of the chemic, and also reduce the non-specific binding. Any antibody or antigen that is non-specific or non-binding, it is reduced, and also improve the test to be accurately, allow the test to be more accurately. That's beneficial of the using of the buffer during to that rapid test. We have the special place you are added it, and that's helping us for the smoothly flow of the sample, maintaining pH, reduce it non-specific, and also improve the test accuracy.